Thank you for staying with us on Health Matters. I'm Dr. Mark Castelaw with Baptist Medical Group. Next, we have Marcia Kirby, a nurse practitioner with Baptist Women's Health Services. Marcia, thank you for being here today.
Thank you for having me.
Now, tell me what you do.
Currently, I have several clinics. I have a benign breast clinic where I see women of all ages with benign kind of complaints, common complaints, breast pain, nipple discharge, breast lumps and bumps. And I work them up for what imaging they need, if they need a biopsy, and if they need surgery, we set all that up for them. Also have a high-risk clinic for those women who are at higher risk for developing breast cancer due to a family history or having first-degree relatives with breast cancer, or those women who've had several benign breast biopsies before. That does put them at a little bit higher risk. And then I see breast cancer follow-up patients in a survivorship program where they've been released by their surgeon or their medical oncologist.
Well, I'd like to take a little bit of fear out of what women sometimes experience when they do self-examinations or they find a little lump or bump. I know I've seen ladies, especially some younger ladies, that might come in with it. And of course, they're scared to death, obviously, and rightly so. So how do you benefit people like that, and how do you evaluate someone that comes in to see you?
Well, first of all, I take a history, and a personal history. How long have they known this change in their body? And a family history is very important. What we do is I'll do a physical exam after history and then determine what kind of imaging they might need: ultrasound, mammogram, maybe a breast MRI. There are several a lot of education to do to decrease their fears, number one, and to help them take better care of themselves. It's all about getting to know what your normal is, because if they just do a breast exam once in a while and all of a sudden they think, well, I think that's a lump, if they don't know what their normal is, then they're going to think everything they feel is
I don't know what their baseline is.
Baseline, exactly.
Well, walk me through a little bit how you help in the recovery process.
What we do is still a lot of education. They have our phone number. Our nurse navigator is wonderful in that they still can call her if they have questions. They can call me with any questions. They can have late effects of their treatments, late effects of surgery with range of motion of their arm, lymphedema of their arm. They can have late effects from chemotherapy, like neuropathies or tingling and numbness in their hands and feet.
So the main thing is they're not ever abandoned.
No,
I mean,
sir.
even though their treatment is done, they're possibly cured of their illness, y'all are still there to support them and help them in any way, which I think is so important.
Absolutely. We never let loose of them.
Great. Well, thank you so much for being here today.
Thank you for having me.
Thank you again for coming, and we'll tell you about new surgical options for women and questions to ask your doctor next. This is Dr. Mark Castelaw with Health Matters.